Good evening. I'm Donna-Lynn Rosa. My pronouns are she and her. I'm the CEO of Atira Women's Resource Society. We're a not-for-profit organization based here in the downtown east side in Vancouver. And we are serving women and children who are fleeing violence with a continuum of housing, legal services, overdose prevention, prenatal care, outreach, and other life-saving services. Prior to this role in not-for-profit, I had a 30-year career in government, both in the East Coast in Ontario and here in Vancouver. I then took a little bit of time to work with a First Nation locally, the Squamish Nation, and I still work with them on contract. It's a privilege and a gift to work alongside people who care the way they do and who understand how to give to each other. And I'll come back to that. The simple solution for charitable giving is actually that government funds appropriately. It's the baseline we should have through partners. But government isn't stable, 30 years in government, and so we must look for a more sustainable approach. If only we could invest in all people so that all of humanity operates from a place of kindness and relationships and trust. If that were our baseline, then we would have our new model simple. The Squamish elders reminded me that we're all connected. So when we do for others, we're also doing for ourselves. Unfortunately, being kind humans is not currently our baseline. We exist in a colonial capitalist system. Due to funding constraints and the overwhelming and growing human need for social supports, nonprofits are forced to look at cost effectiveness over impact. Funding comes with strict guidelines, rigorous administrative reports, audits, and financial reconciliations to ensure that the money is being spent in the way that the funder thinks is best. This begs the question, how can we spread this funding out to make a small difference for the highest number of people? Instead of, how can we actually use this funding to make an actual difference in this person's life? How can we help them in a way they truly want and need? We create administrative roles to seek, have oversight of, and or disperse funding, which then pay for the very administrative roles we employ. It's the proverbial hamster wheel. The administrative burden put on not-for-profits who want and should focus their efforts on service far exceeds the capacity to keep up with the administrative demands put on them by funders. It's exhausting. We know that we're in a homelessness crisis. We know that we're in an opioid crisis. We know that rates of gender-based violence are rising. We know these growing statistics have negative impacts on people's mental health and wellness, yet the amount of available funding stays relatively the same. Nonprofits are forced to fight against each other for this funding, further dividing the sector. We know that this current system is broken. Yet, we are so understaffed and face so much turnover and burnout that we don't have the capacity to even imagine a model other than the one we're used to. So I'm grateful for tonight. When the added burden of jumping through hoops year over year, application over application is layered onto an already depleted staff, the consequences are severe. Recently, we received a grant from the lovely Vancouver Foundation that allowed us to prioritize what we knew would be game changers for our service. This grant, based on, wait for it, trust, kindness, and relationship, still required reporting. However, it had afforded the flexibility needed to support us as providers to be nimble. We are in relationship with the funder that is based on understanding what we do and trusting us to do it with integrity. There's the simple answer. Funding relationships must be based on trust, relationship, and dare I add, kindness. We are known to this funder, and our relationship is strong. Let's take that a step further. What if funders work together to get the most impact for their giving? What if they collaborated, coalesced around social change, like violence against women or homelessness? And what if they worked with the service providers to build trust and relationships? And what if they also worked with the folks they serve to understand the impact firsthand? Let me give you an example. One of my team is doing outreach and encounters someone in distress. Not uncommon. They realize that a cup of coffee and a pack of smokes will help build some trust, so they do that. They sit with the person long after their shift has ended to make sure that this person isn't left alone in a vulnerable state. Chances are good they bought that coffee and that pack of cigarettes out of their own pocket. And for sure, they stayed beyond their regularly scheduled time without pay. No flexibility. Who steps up? Well, someone who's likely from the same margins as the person they are supporting. Someone who will feel the dent of that $10, but does it anyway. 80% of my staff come with lived experience. Those are the folks sitting beside the folks who need to be sat beside. If funders build trust with providers and create funding streams that allow for providers to have flexibility, then that's where the real work is done. You see, when funding is earmarked for A, knowing that what this person actually needs is B, but the funding for B isn't coming through, so we have to provide A. It just doesn't make sense. We provide A and we know this person's at risk because B, that we should have provided, didn't meet the requirements. And they won't be funded next year, or at all maybe. The result of this top-down funding is that anyone who needs these social services are forced to prove that they are suffering just the right amount to gain a temporary solution to their problem. We are forcing the most marginalized and vulnerable people in our community to re-traumatize themselves time and time again that they are suffering, that they are truly suffering, so that we can support them. This is not dignified or compassionate. The only current incentive for corporations and people to donate is tax breaks or positive PR, heroics. We need to shift the language from subsidizing to investing, from nonprofit to continuum responders. We need to look at life-changing impacts for people, not the total number of people we serve. We need to build on hope, trust, and humanity, and dare I say, kindness. Stick to these as our baseline, and we might get through this. Thank you.